Good morning. This is very intimate. I quite like it. Got the smallest room to talk about the biggest topic. My name is Jonny Groome. I'm a paediatric anaesthetic consultant working at the Royal London Children's Hospital. I've spent the last decade or so now working out how to try and make healthcare a little bit greener, starting off how most of us do in the bins, getting obsessed with recycling, and slowly moving into other areas. Now, today, you've got some amazing speakers who are going to share their experience of what they're going to be doing, what they're doing in terms of healthcare decarbonisation. And we're going to have Q&A, so please, we'd love to hear from your experiences. If you have any questions, I want to make this as interactive as possible. Please do stay for the whole event. We've got some amazing showcases at the end of the day as well, where we're going to hear about how new innovative startups are working hard towards more ethical and sustainable practices as well. So, but first, I think it's important that we understand why we're here, what some of the issues are, get an idea of what the current temperature is in terms of the climate crisis. Now, I don't want it to be too grim. There is a message of hope in here, but I think we need to understand where we're starting from. So, like I said, I'm a paediatric anaesthetist. I started out most of my talks about 5 years ago saying the children I anaesthetise today are going to be feeling the brunt of the climate crisis. Very cheesy, but very true at the time. Now, I can't hand on heart say it's just the kids. Everyone in this room is really going to be impacted by this, whether it's economically or from a health perspective. Unless we do something about it, and we can, we're working within a really, really small time frame now, where we can make some significant impacts and differences. And I believe wholeheartedly that it's health that is going to get us out of this mess. So let's talk about kids. UNICEF put out a report recently, and we can see that 1 billion children, as things stand, are at extremely high risk when it comes to climate change. It's not really their fault. They've just arrived. Can't really put the blame on them. And unfortunately, we're losing 1.7 million under fives every year related to changing climate. So it's not great. And what are we doing about it? Well, we've all seen this curve. Way back when, in the pre-industrial era, it was down here, and we saw a big uptick. And we're continuing to follow this upward trend. Does anyone know why we've got this sort of seesaw pattern here in CO2 levels? Exactly, it's a seasonal variation. So deciduous trees, the leaves fall off, their inability to absorb all the CO2 goes, and then the trees grow, they absorb a bit more CO2. But as you can see, the safe level is about 350 parts per million. We're currently skyrocketing at 419. But what we need to also think about and consider is it's not just the fact that the CO2 is present and it's warming. There's other greenhouse gases as well. And we also need to consider that that's going to be around there for a long period of time. About a fifth of the CO2 in our atmosphere at the moment is going to be around in 33,000 years' time. So we've got to act now if we're going to make a difference. And it's not just CO2. This is trapped energy. Okay? The greenhouse gases are trapping energy in our atmosphere. So as things stand, our energy sort of trappage at the moment, we're about 3 watts per meter squared. So imagine a room 10 by 10. Imagine a 300-watt heater, 24 hours a day, 365 days a year, within that room, exerting all that heat. Imagine that on the surface of the entire planet. But let's look at it in another way. At the moment, we are producing the same amount of energy as 8.7 Hiroshima bombs per second. That energy's got to go somewhere. And where's that energy going? Well, it's going into our oceans. We've had record-breaking in 2022 oceanic temperatures. The planet's getting hotter, we know that. It's called global warming, there's the clue. And it's following this upward trend. And we can see these sort of variations, and that's where we have La Nina and El Nino, which sort of forced this increase in warming. And we're about to enter an El Nino phase, and we can expect some pretty hot summers. We've already experienced one throughout Europe. And then that trapped weather has to go somewhere. And that trapped energy, is released in extreme weather events. And we can see here this Met Office data that we are getting an increase in hydrological, climatological events thanks to our changing climate. And let's have a look at the new normal. 2020, we saw Australia on fire, California, the Amazon, Angola, Congo, Siberia. Who could have thought Siberia could set on fire? Indonesia. 2021, Canada, Turkey, Italy, Colorado, Spain, Greece. The new normal. And then we get into this cycle of fire, flood. Summer 2021, Germany, China, huge loss of life from floods. London, we had to close down some of our hospitals in London because of extreme flooding. New York, we saw these amazing pictures from the New York subway, like something from a disaster movie, just water coming in. And huge displacement events happening in British Columbia and Malaysia. Again, 2022, record temperatures again in Europe and in Tokyo in June. And in July, we all remember July last year. Most of the UK was on fire for a start, but we had these huge, huge heat waves throughout Europe. And again, the floods come in. Africa, 2022. Pakistan, a third of the country underwater. Spain, highest ever flood surge in Florida. Venezuela, and a huge 600,000 people displaced in Nigeria in October. You'd think things would cool off in January. They didn't. Bilbao, record-breaking heat. Poland, Netherlands, Belarus, China, and Spain in April, low reservoir levels, extreme heat. June, China. And then Canada set on fire. And we all remember these beautiful but quite dystopian pictures from New York with all that smoke coming down into New York from the wildfires there. July, more floodings in New York, Oklahoma, India. And then again, increase in temperatures again in China and the USA, 52.2 degrees. It's hard to live and work in these temperatures. And then our lovely tourist holiday destinations, we saw all those throughout the news. But I think people are starting to get a bit numb to it all now. I think everyone in this room is probably a bit numb to it all now. We've just gone through, significant disasters. August, more flooding. Hawaii was on fire. The list goes on. September. And what are the climate scientists saying about this? Well, they've spent years and years working on models, working out what's going to happen. And they've put a lot of time and effort into those models. And those models have been right. A few people dispute them, but we are now living the model. We are existing what they were predicting. But what they found has been quite shocking is our vulnerability. Our vulnerability, what happens when these climatic events happen, and the downstream impacts of them. And then for those that want to dispute the models, Sarah Ivory from University of Edinburgh sums it up beautifully. The current climate scenario modelling does not accurately depict the future we know is coming. But to spend time trying to work out whether the models are wrong, it's the equivalent of rearranging the deck chairs on the Titanic. So we know there's no point in disputing the models, bits and bobs. We know what's happening. We're seeing it. We're living it. And it's not just the scientists. So we're bored of the media now. The media are getting bored of it. They've stopped reporting on it. People are sort of getting a bit fed up with scientists, and we don't really believe the scientists anymore. We're seeing this sort of general trend as populism sweeps. But let's see what it means from a financial perspective. Let's see if we can bring more people into this discussion. We can see from this severe droughts and heat waves in the US, 9.4 billion was the cost for that. Florida, the floods, 18 and 20 billion. The World Meteorological Organization is saying so far our bill for the climate crisis is about $4.3 trillion. And then the Institute and Faculty of Actuaries. I didn't know what an actuary was about 5 years ago. Probably wouldn't have wanted to go for a drink with one. But they're very important. They basically look after your pensions, your insurance rates. They predict risk from an economic perspective. And what they say here is we've left it too late to tackle climate change incrementally. It now requires transformational change and dramatic acceleration of progress if we're going to sort this out. And there's a really quite awesome actuary I've been reading a book of recently called Sandy Trust, who's written a book called The Emperor's New Climate Scenarios. And it looks at risk and how the difference between how the scientific community looks at risk and how the financial community look at risks. But within science, we have a sense of reticence about us. You can't say climate change equals this. It has to say it might, or supposedly could. the actuarial world and the financial world do not look at risk like that. You want to look and predict what's potentially going to happen based on probability. And that's why they come out like this and say things like this. Our economy may not exist at all if we do not mitigate climate change. Lloyd's of London, that big building with the pipes outside, on the outside of it in central London, they predict plausible global economic losses of 5 trillion in extreme weather events linked to climate change in the next 5 years. And they predict there's a 1 in 300 chance of a single climatic event having a bill of $17.6 trillion. Now, if someone told me I'd win the lottery and had a 1 in 300 chance, I'll be off buying a ticket right now. But we're here to talk about health. We know, I'm hoping that we know now, that climate change isn't very good for you. From air pollution to extreme heat to trauma associated with extreme weather events and fires, we know it's not good for us. But there's downstream impacts of these big events. So look at all these ghastly pictures I've just showed you. Imagine losing your school, your food source, your water supply. Then what's going to happen? You suddenly start to break apart social fabric and the social determinants of what make populations healthy. And then, unfortunately, all these issues only act to exacerbate pre-existing healthcare inequalities. And we'll see that in some of the figures later on. But what happens if where you live, where you've spent your life, becomes unlivable? Well, you're forced to migrate. And the World Bank Groundswell report predicts about 250 million internal migration cases are going to happen between now and 2050. And what happens when you have lots of people moving and being forced to share limited resource? You create the conditions for conflict. And out of the 25 countries that are most vulnerable to climate change, 14 of them are already at war. So if we're going to be scientific about this, we need to measure these healthcare metrics. And the Lancet Countdown on Health and Climate Change does that every year. And I'd recommend you all read the most recent one, which came out a couple of weeks ago. What it's showing was pretty stark. Heat-related mortality. So this is looking at heat in over 65s. And what we've seen since the period of 2000 and 2004, comparing that with 2018 and 2022, we've seen an 85% increase. And when it's too hot to go outside and work, well, you lose work hours, and work hours equals lost income. So if you're worried about the economy, well, look what we can see here. In 2022, we lost $863 billion due to it being too hot to go outside and work. And it tends to affect the agricultural industry, which tends to be in low human development index countries. We can see here, food security due to heat wave and drought is on the rise. In 2021, 127 million more people experienced moderate or severe food insecurity. And if we don't do anything, we know 1.1 degrees is what we're living now. We know that's not that safe. 2 degrees, which we're not really on track for. We're probably going to overshoot that. But under 2 degrees scenario, we're looking at heat-related deaths increasing at the mid-century point by 370%. Heat-related labour loss increasing by 50%, with another 524.9 million people experiencing food insecurity. And what are we doing about it? Well, the fossil fuel industry is still doing pretty well. We've seen last year investment in the fossil fuel industry increase by 10%. And if the strategies of the world's largest fossil fuel oil and gas companies, as of early as 2023, their strategies, if they were to continue on that, their emissions would surpass the goals that they set at the Paris Agreement by 173%. So they're not doing their bit. But there's some good news. We are seeing a huge uptick in renewable energy growth. It tends to be in high development index countries, but it's on the rise. But when you have people like this scary person from the Pentagon in 2003, I forget his name, but he does look like someone from a film, doesn't he? Saying, the result of the climate crisis could result in a significant drop in the human carrying capacity of the Earth's environment. Pretty scary words from a pretty scary looking guy. And then you've got the World Economic Forum saying climate action failure, extreme weather, biodiversity loss, human environmental damage, and natural resource crisis are in the top 10 of the most severe risks to global economies over the next 10 years. So it's not just the scientists, it's not just the tree huggers. And so look, we know 1.1 degrees, unsafe. We're currently on track for 5.5 degrees. And in fact, there's a paper out recently by Hansen that because we've lost a lot of the aerosols in the earth, aerosols are actually quite a good thing. I'm not talking about deodorant. I'm talking about sort of aerosolization of certain matter, which reflects a lot of heat. This paper was quite grim. It was predicting that this number is more like 10 degrees centigrade. So it's pretty hopeless, to be honest. IPCC in 2021, species extinction, widespread disease, unlivable heat, ecosystem collapse, and cities menaced by rising seas will become painfully obvious before a child today turns 30. I'm surprised you're all sitting here still. Over the coming 50 years, this is a really good paper. I'd recommend it. Written by a group of Chinese and US scientists, predicting that in over 50 years, that should be over 3 billion people are projected to be left outside of survival climatic conditions. And then this paper from Science, species losses become comparable to current and direct human impacts within a century and culminate in a mass extinction rivaling Earth's past. So what are we going to do about it? This paper, Lamboll et al., think that if we're going to keep to 1.5, which is literally dead in the water, but if we're going to do it, this is what we need to do. We need to basically get to absolute zero, not net zero, absolute zero, by 2028. That means this, halving emissions every year from now. That's a big ULEZ. But what are we doing about it? Well, Lord Debham from the Climate Change Committee summed it up pretty well in the UK, how it's going. The failure to act decisively in response to the climate crisis and build on the success of hosting COP26 means that the UK has lost its clear global climate leadership. And I think that's been demonstrated in this last year, rolling back on some of the minimal changes that we're making to try and meet a target of 2050, which, to be honest, the science would agree is not really safe in itself. And then, I'm glad you've all come to join me today, instead of going to this wonderful climate of parties in the United Arab Emirates. Did anyone like COP27? What an event. What did we see in COP27? Well, we removed the target of peak emissions in COP27 this year with our wonderful leader, who is the president of ADNOC, which is their fossil fuel organization of the UAE, who has increased massively fossil fuel expansion just in the last year, is now chairing it. And what they've done this year is they basically said that you're actually not allowed to talk about fossil fuel mitigations at COP28. What a complete joke. And we can see here from Kyoto, Paris, all the COPs, we're still continuing on this upward trend. It doesn't look good. But I have hope in health. This is a letter signed to leaders at COP26 from 46 million healthcare workers in the WHO. And within it, they describe the climate crisis as the single biggest public health threat facing humanity. Let that sink in. We've had COVID, it's pretty bad. The single biggest public health threat facing humanity. Now, those are big words from a big group of people that people have a lot of trust in. We know doctors, pharmacists, and nurses are always in the top 3 of the Veracity Index, which is a survey held by Ipsos Mori every year, asking the public, who do you trust most? So people trust this group of people. And we know that we are a polluting industry. We produce anywhere between 4 and 5% of global emissions. So if the healthcare industry were a country, it would be the 5th largest emitter on the planet. So we look inwards, we know that there's a lot we can do to clean up our own house. And you're going to hear today from incredible people that have been working hard to do that. But I think we also need to use our voice and start standing up and start making a big fuss about the inaction that's happening nationally. And I don't mean, when I'm looking at decarbonisation, I just want to touch on this. We're talking about net zero. We know that net zero is not going to get us out of this problem. We can't be relying on offset. And currently there is no offset. There is no offset in existence which is proven to be effective. That is commercial, I'm saying. We know that from a tree perspective, various rainforest projects and people like Gucci, Shell, Salesforce, EasyJet will rely on for their carbon credits. 94% of them have no benefit at all. And in fact, many of these forests that have been planted have burnt down in forest fires, adding to the problem. But within health, we produce about 5% of global greenhouse gas emissions. But we touch an awful lot of the economy. So we're about 11% of GDP. And we touch on about 90% of global supply chains. So what does that mean? We know that about 60% of healthcare-related emissions come from our supply chain. And you'll find out today, and you'll hear from some incredible speakers, that what the NHS is doing to impact that supply chain. So if you turn around and say to your supply chain, you will no longer be a supplier of this huge, huge ecosystem, and it's happening within the private sector as well, then you start having huge impacts of that 60%, because 60% comes from your supply chain. That's 60% of your 5% of emissions. It's still not going to save us. But if you turn around to Johnson & Johnson, Siemens, Philips, and say, you need to be a net zero organization if you're going to supply to us. Well, they make a lot of other things too. They rely on shipping routes, which will have to decarbonize. And then you start eking in to other areas. Now, there's been a lot in that talk that's pretty depressing and may leave you feeling pretty hopeless. But I'm telling you now, we do have a very small window in which we can do something. We're going to start now. Everyone get your phones out. It's not going to be a selfie moment. So, what can you do? Well, first things first, let's have a look at the banking industry. I want you to type on your server, on your internet provider, bank.green. And what you'll find is you can find out whether your bank is investing in fossil fuels. And then what you'll find is alternative banks. Now, did you know that about the average holdings in a bank for each person in the UK, and I'm not talking about how much is in your current account, but how much value a bank account to that bank has in the UK is about $1.5 million. Sorry, pounds. £1.5 million per bank account. And that's from things like fees, what they invest in, and the like. So if you had to get everyone in this room, or everyone in the NHS, to suddenly shift from a fossil fuel bank to a non-fossil fuel bank, you're suddenly shifting billions and billions of pounds. And that's what we need to do. You'll hear arguments for degrowth. Honestly, while it may agree with my politics, I don't think it's going to work. We need to shift the money. We need to move money away from carbon-intensive industries to low-carbon industries. Now, open up another web page. You're all going to change your energy providers today. And there are a couple in the UK that are actually 100% renewable. 100 Green, Ecotricity, Octopus. And what does that do? That sends a message that we want to shift money away from fossil fuels here in the UK and on to greener pastures. I'd recommend, if you're on LinkedIn, have a look at this. I'm not affiliated with this group, but this is probably one of the most important groups at the moment in climate. They're called Real Zero. And they are working with industry, with suppliers, helping them, guiding them towards not net zero, to actual zero, significant carbon reduction. And they'll show you how to do it. Because a lot of it, due to competition, is getting everyone to jump together and feel confident as a whole supply chain, as a whole sector, in jumping together. So look, I'm going to wrap up. And I'm not going to go all Chris Packham on you now, but it's pretty beautiful, isn't it? We're not here today to save this. We're not here to save the planet. This lovely little marble has torn itself to pieces. It's set itself on fire. It's frozen. It's done lots in its long lifetime. We are now starting to change that normal planetary ecosystem that it's been going through. And what is at threat now is not the planet. It's our survival within it. The planet's going to be fine. But we've been pretty good on this planet so far. We've been innovative. We've created incredible, incredible civilizations. Now, I think it's time to save those civilizations. And I think we can all do something about that here in health. We can't rely on our leaders. If we're going to be true healthcare professionals and have a duty of care towards our patients, it's essential that we have a duty of care towards our planet as well. Grand. So, we're really lucky to have Home Alone. Fantastic. I love it. So, to start off, we're going to hear from someone who is making a big difference, working with something I'm incredibly proud of, which is the NHS.